I'm Lisa Oyer from the Columbus Medical Association, and while I work with doctors every day, I'm still like many of you. I'm a mom living in Central Ohio, trying to make decisions for me and my family so that we can stay healthy and somewhat sane. Today, I'm joined by Dr. Kman. Dr. Kman is an ER physician at the Wexner Medical Center, and he's going to give us some straight answers on what's best for Thanksgiving celebrations this year. Hi, Dr. Kman.
Hey, thanks for having me.
Thank you. I know you're really busy right now with patients, so thanks for taking the time to help me sort this all out.
No, I'm happy to do it.
So I'll start out. I'm on social media enough to know that there's a lot of angst about how to celebrate Thanksgiving this year. Why do you think it's become such a hot topic?
Well, I think we're all getting fatigue from the pandemic. I think early on it was very novel and, we felt like we were doing our civic duty by staying home and maybe wearing masks. But now it's become intrusive and, we're not able to live our lives the way we want to. And that's a hard thing to handle. I think, Thanksgiving has always been a time where people can get together inside and enjoy a good time. But the problem with Thanksgiving is the weather and everything else going on makes it nearly impossible for people to be outdoors and be distanced. The very nature of us gathering closely and eating and drinking together is really a recipe for what COVID needs to spread. So people don't want to hear that, frankly. They want to see their loved ones, and we totally get it.
Yeah. So is there anything specific that the science tells us about this?
Well, yeah, I think what we're seeing is in the summer, it's more humid out. We're all outdoors. Contrast Thanksgiving Day with the 4th of July. The 4th of July, you may have your neighbors over, people at your house. Everyone's outside in the yard, and even you're probably eating outdoors. COVID doesn't like to spread that way. But for Thanksgiving, it's low humidity. We know viruses spread in the winter anyway because we're in such close proximity. And then, despite what I've seen on social media, masks work. And, if they didn't work, then there wouldn't be anyone left working in the hospital. We know they work. The problem is it's a situation where it's going to be hard to keep it on your face. If you're eating and drinking the whole time, your masks are going to naturally kind of come off. And we've seen that informal indoor gatherings are where the virus is spreading. It's very hard to keep it out of your house when the community spread is so high. So, for example, if the community has a 10% rate and you have a Thanksgiving gathering with 20 people, the odds are there's going to be a couple people at your house that have COVID. Wow. And they may not have symptoms, or they may be pre-symptomatic. And I've seen that a lot. So pre-symptomatic means they're infected, they're able to shed the virus, but they haven't gotten any of the symptoms yet. So somebody's at your house on Thanksgiving Day, and then Black Friday, they lose their sense of smell, and now everyone's been exposed. So, it's really difficult, and it's going to take a lot of discipline from us to do this.
Okay. So you're an ER doc, and we've all heard about how busy the hospitals are getting right now. How could they be impacted by post-Thanksgiving celebrations?
Yeah, these landmark days, we can actually track how hospital volumes change. So we're a little over 14 days out from Halloween, and we're seeing this like a meteoric rise of cases, and the hospitals are always very full. So our hospital gets very full like this in January, typically, because of influenza and other things going on. The problem is we're in November, and we know we're going to see that rise in cases. And so what starts to happen is this: as the ICUs are full, and a lot of the rural hospitals are almost completely full, the care that we deliver to patients is not the same. It takes a lot longer for patients to go from the emergency department to be admitted in the ICU, or to get a service, a team of doctors inpatient to start to take care of that person. Or, at hospitals, if there's 40 patients in the waiting in the emergency department, waiting to go upstairs, there's usually 40 or 50 in the waiting room waiting to come back to the emergency department. And the waiting room, we just have a lot less control over. So, there might be some patients with respiratory symptoms or COVID that are out in the waiting room, and we're trying to get those patients back. But when the hospitals are full, we can't see those patients. So, I'm not going to lie, when the hospital's full, I think healthcare can suffer and people can wait longer, people get turned away. Um, Fortunately, right now, we're still in a point where we have ventilators and personal protective equipment at most of the hospitals that I've heard about. Now, I've heard nationally there's places where they might be down to their last ventilator, but this is why we tried to flatten the curve early in the year. We wanted to make sure that we saw this gradual spike of patients over a longer period of time, and now we're seeing them all kind of at once, and that's been difficult for the healthcare system.
All right, so let me get real here. Let me tell you, Thanksgiving is my favorite holiday of the year. I'm a cook, and I love to host really big gatherings with tons of food and beverage. And my thinking is I'll scale things back and only have my kids and my in-laws, and thinking about a neighborhood family that's been part of our bubble since March. Is this okay?
Everyone has to make these risk determinations on their own. Are your kids in school? We've seen in children over the age of 10, there's a high incidence of the virus. Is your mother elderly or have comorbid conditions? We know patients over the age of 65 with 2 or more comorbid conditions are at a much higher risk to die or get very sick from coronavirus. The other family, do you know who they associate with? So every time you invite somebody into your house, it's also the kids that were on the bus, it's the kids that were in school with that person, who's on the hockey team with them. So the safest thing you could do is to keep this to your immediate family. I think what we tried to do while we're getting personal is there was a really nice weekend, 2 weekends ago when it was in the 70s. We went up to Cleveland to visit my family. We all stayed outdoors the whole time. We ordered some pizza and stuff. You set it up and people eat outside. That was kind of our Thanksgiving gathering. Actually, on Thanksgiving Day, I work in the emergency department, but when I get home, we're going to just have our family and we'll probably FaceTime with my parents. So if you feel like you can have 100% compliance with masks, hygiene, and distancing, then you can try it. But you have to take all these considerations into account. With our community spread the way it is right now, it's very likely that somebody who's asymptomatic or pre-symptomatic may be sitting at the table with you. So that's what you have to think about.
All very good information about my Thanksgiving preparation. Would it make any difference if any of the people I mentioned got tested for COVID beforehand?
Yeah, so that's a really great question, and I've gotten asked that a couple times. So if we get everybody tested 48 hours before the celebration, we're safe, right? Well, I think we've seen with sports teams and with, what's happened in government that do have aggressive testing, that process can still fail. So if you get exposed to coronavirus 36 hours before you take a test, you may be asymptomatic or pre-symptomatic and not shedding enough virus for the test to pick up, for the test to be positive. The rapid tests tend to only be 50 to 70% sensitive, which means it's going to miss some positive cases. So I think it would help. So let's say you get everybody tested and somebody's positive, then that certainly helps, right? Obviously, those folks would go into quarantine. But if everybody's negative, it might give you a false sense of security. Oh, we can all just take our masks off and let's hug and get together and have a happy Thanksgiving like we've done in the past. And unfortunately, getting everyone tested is not foolproof. It may help, but we still need to do social distancing. We still need to do hygiene. We still need to do masks. We still need to pay attention to those things as well. But I'm glad you asked that question.
Thank you. Okay. Well, Dr. Kman, thank you so much for these straight answers. I think it's what I need to really consider.
Can I leave you on a quick positive note? Because
Yeah,
I feel like
please.
all we talk about with COVID is doom and gloom. We received our first shipment of monoclonal antibodies on Monday. And these are synthetic antibodies that help patients fight the virus. And we've infused patients throughout the week. We know the vaccine is on the horizon. We're not asking people to not see their family indefinitely. I think this is the holiday, Thanksgiving and Christmas are going to be impacted, but I think a lot of us in the healthcare field see a light at the end of the tunnel. And that's what I'm trying to tell my family is we gotta sacrifice this one, but we're getting close to being through the worst of it. So I just wanted to leave kind of on a positive note because nobody wants to not see their family.
All right. Well, that really helps. That helps me personally. I hope it helps everyone that's viewing this. And again, I really appreciate it, and stay safe, taking care of the community.
Thank you, and have a happy Thanksgiving.
Thank you. That was really good information that Dr. Kman shared. This is what I'm going to change. I'm scaling back even further to just my family members and my immediate household. I have lots more questions about how to get through this, and I'll be asking local expert physicians just like Dr. Kman. So watch for more interviews to come. And remember, what we do together counts more than ever.